I'm Dr. Zacharias. I'm an orthopedic sports medicine specialist here at Freighter's Health. Hip pain can be caused by a multitude of factors. One such cause is femoroacetabular impingement. In this pathology, this can be caused by one of two factors. You can have either a decreased transition of the femoral head into the femoral neck, a deep hip socket, or a combination of the two. In femoroacetabular impingement, this abnormal bony contact will eventually cause damage to the labrum of the hip socket. This can eventually lead to cartilage damage further down the road. Treatment modalities for femoroacetabular impingement include typically starting with physical therapy, activity modification, and consideration of intra-articular injections of a corticosteroid. If these treatment modalities do not give satisfactory results, typically we will start to discuss hip arthroscopy. With arthroscopic surgery, I typically use 3 small incisions around the hip joint to introduce arthroscopic instruments to evaluate the hip joint, repair the torn labrum, clean up any torn cartilage, and then recontour the bone to prevent the damage that was caused by the abnormal bone contact in the first place. Patients typically go home on the same day of surgery. They are 20% weight bearing on crutches starting right away after surgery, and typically will transition off of crutches to full weight bearing at around 2 to 3 weeks. For the first 6 weeks after surgery, patients should be limited on their extension of their hip, bringing their hip out to the side too much, and rotating their hip too much. After the initial 6 weeks after surgery, patients are just restricted on their lifting to no more than 50 pounds. Starting 3 months after surgery, impact activities are initiated, and patients typically return to sport and full work at around 3 to 4 months. If you'd like to be seen and evaluated for hip pain, please reach out and you can contact us and we can get you on the right track as soon as possible.